Public health physician OHAZURIKE joins us on the Midday News for an expert's view on this. Thank you for joining us on the news. Now, quickly tell us why there is a spike in the death of persons when it comes to Lassa fever, because it doesn't seem like we've witnessed this in a while now.
Good afternoon, and thank you for having me. I would want to quickly correct the notion. What is actually happening, it's right. On a week-to-week basis or on a month-to-month basis compared to previous years,
Yeah.
The number of cases is actually higher for 2020, for January 2020.
Absolutely.
But looking at the number of deaths, we have fewer deaths compared to other years.
Really?
Yes, so that means the capacity of the health systems to pick, to detect the viruses in people who are affected has improved, and the alert level at the healthcare facilities is actually higher. So the case fatality rate for this year for witness so far is actually lower.
But one would expect that for over 51 years we've been dealing with issues of Lassa fever, that by now we should have had a permanent solution to dealing with the scourge.
That would be right, because Lassa is a very Nigerian disease. It was found in Lassa village in 1969. The Center for Disease Control and Research Institutes in Nigeria are really on the forefront of working with development partners to develop a vaccine for Lassa fever. So until we develop a vaccine for Lassa fever, all we have to do is continuously to prevent, to detect, and to respond to
and one wonders why it's taking us this long to come up with a vaccine. We have research centers. Is it so difficult to come up with?
I think the process of even producing a vaccine is not a day's journey. But the process is actually ongoing. What we want from Nigerians is to be able to avail themselves when the vaccine becomes available for research, because even before you deploy vaccine to the general population, it has to undergo community trials, field trials, just like they've done for Ebola vaccine in DRC. So even when the process comes for Nigerians to become volunteers, to participate in community trials for vaccines, we're hoping that they'll be willing to render themselves.
But in the interim, are there steps or things that people can do on their own part to, serve as prevention?
Yeah, I think the NCDC has already issued what we call the Public Health Advisory for Lassa fever. And that advisory is actually targeted at individuals and communities. And
is that having an impact at all with the rising cases?
I think what is actually happening is that the system is stronger to pick it. Before, people would have this illness and die and nobody would even know the cause. So while we're having increase in confirmed cases is because the system is strong enough to detect the cases.
I am talking about the fact that the NSCDC has come up with preventive measures, but it seems that people are not taking that into consideration.
I think that is why we're having this conversation, because we have to continue to push the message to individuals and to communities, because this virus actually is resident in rodents. So it is man's contact with rodents that starts the disease in the first place. So if by our behaviors, if by human behaviors we let the rodents be, maybe the disease would stop.
All right, let's leave it here now. Thank you so much for your time, Doctor, for speaking with us. Thank you.